But recently I have made a detour away from my studies as I have been seeking help for arthritis. All right. I have been looking at eating raw as a way to reverse the arthritis. An allopath had diagnosed me with osteo-arthritis and told me I was spread to all your fingers. I am thinking, no way. My little finger on my left hand is literally misshapen. The bottom knuckle very big, so the away my finger's still not looking good. Now, so what are my goals? I am going to find a way to reverse the arthritis, Well, if you treat this like a disease, sweetheart, and this is the thing as a nurse you have to break free from. Thanks, sweetheart. I love you too. Guy or girl. Arthritis. Let's look at it. Osteo, RA, doesn't matter. Arthritis. What is that? Inflammatory problem where? In the joints. But let's look at this. What system would be involved with arthritis? Would it be your blood? Nope. Let's try another one. Well, wait a minute, there's only one more. So we want the system that causes the owies, right? That's the lymphatic system. So what's going on with you? Kidneys and adrenals, sweetheart. You've got to fix your kidneys and adrenals, clean up your bowels, get your lymph system moving, and it's going to... Arthritis is more chronic. I've said this before, but you can get rid of this. You get rid of these acids, and these joints, these fingers, will straighten themselves right back up. It's going to take you about a year to do it. At least put yourself in that way, but you want those fingers straightened right back up because this is happening all through you. This acidosis just isn't in the joints, by the way. This is all through you. This just happens, the joints just happen to get the most movement, therefore produce the most acids. So they're the ones more prone, but it's head to toe. So this is something that you gotta fix, and that's moving your lymphatic system, dear one. You're just such a great soul. You get in there and you tear this apart, and you get that body well. Get your adrenals up. There's your steroids. Get your kidneys filtering, and get your lymph system cleaned out, and all these acids will come out. I've straightened up so many gnarly fingers straight again. It's not even funny. Matter of fact, a local newspaper was in. My office one day along with Fox News, and they were recording a story on a cancer case, and this little old lady, she was 70-some years old. She was an organ player at a church, and I think I brought her up before. She had gnarly fingers. She couldn't play anymore, and in 3.5 months, total raw, her fingers were all straight but one. And when they were in there with the camera, she said, well, I've got a story, and they went like this, and she showed her hands, and she made the newspaper and the story too. Diagnosed with RA, rheumatoid arthritis, when I was about 23. Methotrexate. Oh my God. Typical stuff. This is just sad stuff here. Rheumatoid arthritis is generally, remember, in RA cases, if you look at the eyes, in 99% of the cases, you're going to see the sulfurs. So they're high antibiotic use. You see high uric acid from high fungal problems. So they have high fungal problems, high acids, of course, just like any acid, any fibromyalgia, any lupus. Put all these things like lupus, fibromyalgia, Lyme's, any arthritis, systemic inflammation. What is systemic inflammation? A viral problem? Not even close. Virus has anything to do with that. This is high acidosis. And acidosis is really a big issue. This is a big issue. And RA, let me read on before we get into that too much. Steroid injections, of course, in shoulders and stuff. And this, of course, then this shuts down the adrenals even more. So then it becomes even more accentuated, more steroids. Pretty soon they lock you in a dark room in Hellville. Not smart, not good, not 21st century. We got to come out of the darky ages on this planet. Holy crap. Went into remission at 25. There's no such thing. I got it back after I had been on weight. You're not fighting a disease that's coming in and out of the body. You treated it, you suppressed it, and it come raging back saying, hello, you never cleaned me out. Acids. I was put on fluoxetine or something for 6 years for severe depression. Well, extreme acids, extreme pain would make anybody highly depressed. Feel sorry for you, honey. I had stopped taking it for 3 years ago, and up until 2 years ago, I was suicidal all the time from the pain. No kidding. I don't blame you. This is why, guys, these cases like this poor individual is why we do what we do. You know what? It's why we do what we do. The suffering of men. That the suffering should not be. After the RA returned so aggressively, and it didn't return, it was always there. They just suppressed it for you with the steroids. Not tolerating methotrexate, no kidding. And had liver function issues, no kidding. That was cleared and continued on the following drugs till now. Humira, oh yuck, oh my God. I keep listening to the side effects of Humira. Sweetheart, and she's listed a lot of other things. Side effects I've had in injections. The Humira almost gave me my life back. Again, come raging back on you. Oh man, as it stands, I have bursitis in both elbows. You have so much worse than all this, sweetheart. You just have so much acidosis. You have systemic acidosis. You want to get in there, get those bowels cleaned up, get those kidneys, rake that body clean of all these acids. Get your kidneys filtering, get your adrenals back online from the steroid uses, get your own steroids up, get your kidneys filtering, clean that bowel. Get that sulfur out of your body. If you're one that doesn't have it, which I'd be totally amazing since you've been on high sulfur drugs, you want to get that out of there and get these acids out. If you don't open it up, open up the skin, get your parathyroid and thyroid back up, hopefully pull you out of depression. But this is a pain depression, sad thing. But again, you're going to be losing calcium at a rapid rate to all this high acidosis. And depression comes in with loss of calcium. So you got to do just what this channel's talking about, sweetheart. Just want to get on Facebook if you're already on there and get these people to help you walk yourself out of this one, because this is tough. You're going to be working hard. It's going to take you a year or two to get yourself out of this, but you will get a remedy. And that's what you're looking for. How do I get these acids out? Acids, pain. Synonymous. Oh, good. Since finding your videos, it gave me hope again. I started following your directions to eat mainly fruit, and thanks so far. I've maintained an 80% raw diet, excellent, and juicing veggies at night, but I am still eating lollies and breads. Well, it's because you have fungus. Take that parasite M or something equivalent to that and stay on that for a while until you don't crave starches anymore, because you're going to have a lot of fungus in the body. And remember, fungus like candida, fungus and moles and things like this, they crave sugars. And so that's why we crave starches. Fermented starches, by the way, and cheeses. Any fermented foods, that's what we're going to crave. That's fungus. And of course they leave uric acid crystals in the body, which is that little pinprick pain. So you want to get yourself cleaned up that way. Also, stop taking all my drugs except an anti-inflammatory. Well, all your fruits, berries, and melons and vegetables are anti-inflammatories, and there's a ton of herbs that are anti-inflammatories. So we have an anti-inflammatory formula. So work with these sort of anti-inflammatories, because you have to be careful with pharmaceutical anti-inflammatories because they're killers. You got to be real careful, and you do not want to slam your adrenals anymore, or you're getting yourself in a little dark room in Hellville. My question is, what herbal should I be taking to fix the arthritis? Full bore program. Get in. Go on the first kit that gets the worms out. It starts to open up all the doors. Then get your 2 kidneys, your 2 lymphatics, 1 capsule, 1 tincture. Clean up your GI tract. Get the GI broom. Start pulling this sulfur out of the body. Get your kidneys filtering. Make sure you see sediment in your urine, sweetheart. Got to do this. I would do grapes. Krista's on this high grape fast. That's what I would do. You might find that certain foods exacerbate pain. Stay away from your cruciferouses. These are sulfur veggies. Stay away from them. Get into your sub-acid fruit category and your sweet fruit category. If you can tolerate oranges, organic, ripe ones, by all means. If you can tolerate grapefruit and lemons, by all means. But I tell you, you might not tolerate those. You know, these are bad. Stay away from the nightshades. That's tomatoes, potatoes, eggplants. Stay away from all these kind of foods. Give yourself subacids. Give yourself melons, papayas, things that soothe. Things like this. Maybe even watermelon can be too aggressive for some people in pain, believe it or not. Dear Dr. Morse, I just need a brief answer to one question. Have you had any success in reversing arthritis in hips, regenerating hip joints? Absolutely. Oh no, that's a done deal. But if you get on bone and you're going through a lot of suffering and you're elderly, you might want to get a replacement, because it's going to be a long while to rebuild bone on bone, and where you get in destructive tissue like that. And just in an older person, they've got a lot of work ahead of them. You see how much work, I think a lot of you are beginning to see how much work there is. My mom, 65. Now, she's only 65, so yeah, I would tear it up before she loses too much tissue there, and the knees and all that. Pain and wear and tear and stiffness. This is what she has. Coaxarthros or something. That's all acidosis. Obvious pain, acidosis, wear, acidosis, tear, acidosis, stiffness, acidosis. Wow, that was easy. Well, there's only two sides to chemistry. Pick one. This is generally not alkalosis that causes these problems. It's in both hips. So what's happening with her? Yeah, she's losing her kidneys, which is about par for the course around the world. So kidneys and adrenals are at the key of this issue. And even with the steroids of the adrenals probably running low for her, so not much help for her. So I have to get the kidneys and adrenals moving and get those kidneys filtering. And this is what this is showing here. She never sees any MDs and lives a pretty healthy lifestyle. And you can live a pretty healthy lifestyle, and just through the advent of your genetics and the earlier parts of your life and your diets, see you later, kidneys. And unless you take that extra mile and go deeper to regenerate, you just hold it where you are. So if you went into a raw food diet, you basically could hold that right there and not get well, and you'd be on a raw food diet. Now, this is reversing what you've created. And so that requires a high fruit and berry and melon diet. The more I talked with all of you at the class, you could see those that understood the differences of the salads, because they went up into the fruits, and all the testimonies we had of people that when they hit the fruit, they really started to see action and deeper detoxification. And it's an obvious, it's not even a point to argue over. People that argue over just never got up into the higher levels of detox. Those that do, okay, then we have legitimate conversations, and we can articulate what our experiences were. So it's important to, when you're having an articulation or a dictation, that you have it with like-minded people that have been on these journeys. And for those that have never been, it makes for good listening material. And hopefully some energy to pull yourself that way. Let me see. She started an all-fruit salad, all-night diet 2 days ago. The orthopedist said she needs both hips replaced. This is Kim. I don't know what to say, Kim. I'll say this, that if she's not bone on bone and not in a lot of pain, then she has time to work on this. If she is on bone and in a lot of pain, then you have to make that decision. And either decision that you make, you have to fix the causative factors. And the causative factors is the lymph system and not filtering properly through the kidneys, so you're developing acidosis in these tissues, which is common. The knees go, the hips go, the shoulders go, the elbows go. This is just all acidosis, just classic stuff. But there's a lot more going on inside, too. This is the problem. This acidosis just isn't in her hips. It's all through her. So this is the other thing you have to consider, is that when you're having pain and discomfort and your hips are breaking down, you're actually breaking down tissue all through you in one way or another. This is what people have to understand. This is a systemic problem, not a local problem. It appears to be local because that's where the pain and suffering is currently, but really it's... So anyway, Kim, you definitely tear it up, like with the basic protocols we've been discussing on this site. I'd probably also pop up that parathyroid. I'd take the Bones formula three times a day, and I'd probably supplement with some kelp on top of that. That gives you the iodine and more calcium. Popping up the parathyroid gives you parathermal. Make sure the thyroid is good too. If not, pop that up too, because that's calcitonin. Both calcitonin, which is thyroid, and parathormone, which is parathyroid, are responsible for 1, blood level calcium, and 2, calcium and phosphorus bonding, etc., etc., etc. So all of that is just getting these tissues healthy again and getting this lymph system cleaned up, and then we're in pretty good case here. but you have to see how far advanced you are and whether you want to take the time to rebuild those. I had heard you say numerous times to avoid the acid fruit for people who have severe arthritis, like RA, rheumatoid arthritis, and probably some other symptoms. I don't understand why. When the body metabolizes the acid fruit, isn't the net result on alkalizing effect on the body? It is. But there are still, especially when you pick unripe, there's still acid factors in some fruits, like the citrus fruits, and it's just like tomatoes. They're still there that can set off acid against acid. Don't ask me why that is. Now, good ripe fruit, you won't see that. But in America here and in some parts of the world where the fruit is very unripe, even at the grocery stores, that's problematic in the sense that it tends to be more on that growth side, more on the acid side. That's the number one problem with citruses and everything else. You pick a organic orange off a tree. If it's not as sweet and it doesn't put a smile on your face, somebody didn't know how to grow that fruit. When you eat a piece of fruit, you should be going, oh baby, this is so good. Oh man. That's when a farmer can grow fruit like that, we're all going to get healthy, because that's exactly what Homo sapiens are looking for, that burst of flavor and deliciousness that good fruit picked ripe is. But we have a very serious problem in this country. It never started out with the markets like in some of these islands and things where you go to the market every day and the trucks run every day with fresh fruit. Instead of picking for days in advance, they want fresh fruit every day. But again, they're on an island that grows that. Here, we don't have such luxury. We haven't grown the pyramid greenhouses yet or all the other stuff. So, we are putting up with this. What exactly do acid fruits do? My mom has severe arthritis in her knees, and I'm feeding her a grapefruit every morning, and I'm wondering if this is... It's not damaging, but if she doesn't feel worse or more pain with it, keep her going on it, because grapefruit is definitely a great cleanser and alkalizer of the human body. So don't let that stop you. If she notices more pain eating it, then I would shift to grapes or something. Apples, grapes, peaches, the subacid category. I'm just saying, it's definitely true on nightshades. But I've had cases where they were so acidic that even the acid fruits caused them a little problems. This lady is RA, rheumatoid arthritis, fibromyalgia, about the same thing. This is systemic, this is chronic systemic acidosis. Now, you might check your eye, sweetheart, to see if you have orange in your pupil, because I'm telling you, I hardly ever see an RA case without a lot of sulfur. And that just adds for a lot of fungus, uric acid, da-da-da-da-da. So it's all about acidosis, but then the initiating factors. And like I said, RA tends to have a lot of sulfur. But irregardless, you have to clean it all out of you. It'll take you a little time, but you can get yourself out of pain and you want to. Guess what's down in you? Big time adrenals. Hit the adrenals and get the kidneys going too, because you need those steroids in your body, no question. We have a new inflammation joints coming out. It should be stronger than the one we have. I have used my inflammation joints on RA a lot. Some people it helps, some people it doesn't. So you have to see that. If you're all twisty and gnarly, you really got to dig in. Get all this acid out of there so everything goes back to straight again. This is a very painful situation, definitely not fun. Anybody that pumps proteins and bodybuilders or athletes generally end up with RA. Not good. It's not fun. You lose your joints. It's not fun. And it's not worth pumping protein. It's worth getting into pumping green protein if we could use it that way.